Chapter 2, Medical Terminology for Sterile Processing Technicians. Welcome to the study of medical terminology for sterile processing technicians. This language is the standardized tool used by all healthcare professionals to communicate effectively and accurately. For the central service or sterile processing technician, mastering this language is not an optional skill. It is a critical requirement for daily operations. You will use this language every single shift, whether you are reading a surgery schedule, interpreting a surgeon's preference card, or listening to an urgent request from the operating room, or to perform your job safely, you must understand the precise meaning of these medical terms. In the medical field, precision is paramount because a single word or even a single letter can differentiate between a routine procedure and a life-saving emergency. Using correct terminology is a mark of professionalism that enables you to communicate clearly with surgeons, nurses, and infection preventionists. You must strictly avoid the use of slang or jargon. For example, instead of using a vague term like the heart tray, a professional technician uses the specific name, such as the open heart or cardiovascular set, to ensure there is no ambiguity. The operating room is the primary customer of the sterile processing department, and to support them effectively, you must speak their language. This knowledge allows you to interpret needs instantly. When an operating room nurse calls for a retractor for a laparotomy, you must immediately understand that laparo refers to the abdomen and tomi means an incision. This allows you to locate the correct instrument tray without delay. Misunderstanding a term can lead to the wrong instruments being delivered to a room, which creates a significant safety risk. For instance, confusing the root cysto, which refers to the bladder, with cyto, which refers to a cell, could result in delivering a bladder scope instead of a pathology tray. Ultimately, the purpose of mastering this terminology is patient safety. Every patient deserves to have the correct, sterile, and functional instrument ready for their specific procedure. Errors in pulling case carts, often caused by terminology mistakes, are a leading cause of surgical delays. By mastering this language, you ensure surgeries start on time, which directly contributes to quality patient care. Beyond operational efficiency, you also have legal and regulatory responsibilities. You must be able to identify approximately 100 surgical instruments to be considered proficient. Furthermore, you must adhere to HIPAA, the Health Insurance Portability and Accountability Act, which protects medical records and protected health information, PHI. Protecting this confidentiality is your direct legal responsibility. Regulatory standards from OSHA and the FDA also intersect with your daily work. Under OSHA regulations, specific medical records regarding your occupational exposure must be established and maintained for the duration of your employment plus an additional 30 years. Regarding the equipment you handle, the FDA requires manufacturers to provide validated instructions for use, IFU, for all reusable medical devices. You must accurately interpret these IFUs to ensure every item is processed safely according to the most current standards. If a medical device malfunctions, the Safe Medical Devices Act, SMDA, requires facilities to report the incident. Specifically, any device-related death must be reported to the FDA within 10 workdays. You must also understand FDA recall classifications. Class 1 is a high risk where a product can cause serious health issues or death. Class 2 involves potential for temporary or reversible health consequences. Class 3 is the least serious risk, where the product is unlikely to cause adverse health consequences. Moving now from the regulatory framework to the actual structure of the language itself, let's examine the anatomy of a medical term. Building on this conceptual framework, we must look at how these terms are built. A medical term is essentially a sentence condensed into a single word, constructed from specific linguistic building blocks, roots, prefixes, suffixes, and combining vowels. Understanding this anatomy allows you to decipher complex terms you may have never encountered before, rather than simply trying to memorize a dictionary. The foundation of any medical term is the root word. The root establishes the primary meaning of the term and almost always refers to a specific body part or organ system. It is a fundamental rule that every medical term must have at least one root or a root-like base. For instance, the root cardi always refers to the heart, gastro refers to the stomach, and osteo refers to the bone. When you see these roots, you immediately know the anatomical address of the procedure or condition being described. To modify these roots, we use the prefix. The prefix is the element attached to the very beginning of the root word. It functions as a modifier that provides critical context regarding location, time, or status. For location, you might see sub, meaning below, or inter, meaning between. For time-related information, pre means before and post means after, concepts you use daily when discussing preoperative or postoperative processing. Prefixes also indicate number or status, such as bi for 2, hemi for half, or hypo, which means deficient or low. It is important to note that while every term must have a root, not every medical term will necessarily have a prefix. The third building block is the suffix, which is the element attached to the end of the root word. In the world of sterile processing, the suffix is arguably the most critical component because it determines the specific action being taken or the condition present. It tells you exactly what kind of surgery is being performed and, by extension, what instruments will be required. Common examples include itis for inflammation, ectomy for surgical removal, plasty for surgical repair, and tomy for cutting into or making an incision. To make these complex combinations easier to pronounce, we use a combining vowel. The letter O is the most frequently used combining vowel in healthcare. There are 3 specific rules you must master for their usage. First, a combining vowel is used when the suffix begins with a consonant. For example, when you combine the root arthro with the suffix plasty, you insert the O to create arthroplasty. Second, the combining vowel is usually dropped if the suffix already begins with a vowel. Therefore, arthro combined with itis becomes arthritis, not arthroitis. Third, when you are connecting 2 different root words together, the combining vowel is always kept between them, even if the second root starts with a vowel. This is seen in gastroenterology, where the O remains between gastro and enter to ensure the word remains phonetically clear. To define these terms accurately, you should adopt the strategy of reading the word backwards. First, define the suffix to understand the action. Second, define the prefix, if one is present, to understand the modifier. Finally, define the root to identify the body part. For a total abdominal hysterectomy, you would start at the end with ectomy, meaning surgical removal. Then you look at the root hyster, which refers to the uterus. Finally, you look at the modifiers abdominal and total, which tell you the approach is through the abdomen and the extent is a complete removal. This systematic approach ensures you understand the full scope of the procedure. Just as medical terms for diseases follow this pattern, the names of surgical procedures follow strict naming conventions. By understanding the formula of body part, root, plus action, suffix, you can anticipate the instrumentation needed for almost any case. This formulaic approach to naming procedures is best demonstrated through the Big 5 surgical suffixes. These 5 endings describe the vast majority of surgical actions performed in the operating room, and as a technician, you must commit them to memory to understand your daily workload. The first is ectomy, which means the surgical removal of an organ or tissue. A common example is an appendectomy, the removal of the appendix. Second is orrify, which refers to surgical repair or suturing. You will see this in a herniorrhaphy, where a surgeon is stitching a hernia back together. Third is plasty, meaning surgical reconstruction or reshaping, such as a rhinoplasty to reshape the nose. Fourth is otomy, which refers to an incision into or cutting into a body part. An example is a tracheotomy, where an incision is made into the windpipe. Finally, the fifth is ostomy, which means creating a new, often permanent, opening. A colostomy is a prime example, where an opening is created for the colon to bypass the rectum. It is absolutely vital that you do not confuse otomy with ostomy. This is a frequent source of error in the department. Remember that an otomy is generally a temporary cut or incision that is closed at the end of the surgery. In contrast, an ostomy involves the creation of a stoma, which is a permanent or semi-permanent hole used for drainage. Delivering the wrong specialized drainage supplies because you misread these suffixes can directly impact patient outcomes. Beyond the action being performed, medical terminology also reveals the approach, which tells you how the surgeon reaches the surgical site. This classification determines whether the surgery is open or minimally invasive, which dictates the size and weight of the instrument sets you must prepare. Open surgery requires a large incision to provide the surgeon with direct visualization and physical access. These terms often lack a specific prefix or simply use the word open, such as open heart surgery. These cases require large, heavy instrument sets and major retractors. On the other hand, minimally invasive surgery, MIS, is performed through small keyhole incisions. These procedures are identified by specific prefixes, endo for internal visualization, laparo for the abdomen, or arthro for a joint. When you see a laparoscopic cholecystectomy on the schedule, your terminology knowledge tells you that in addition to the standard instruments, you must prioritize the lap video tower, the camera, the light cord, and the rigid scopes. Understanding the approach ensures the OR has the complex electronic equipment necessary for the case to proceed. Finally, surgical terms reveal the purpose of the procedure, which helps you prioritize your processing. A procedure may be diagnostic, meaning it is performed to find the cause of a problem, such as a biopsy or an exploratory laparotomy. Or, it may be therapeutic, performed to treat or cure a known condition, like a total knee arthroplasty. You may also encounter reconstructive surgery, which focuses on restoring form and function, such as a mammoplasty following breast cancer, or restorative surgery, which returns the body to health, such as fixing a bone fracture. With this understanding of surgical actions and approaches, you can now effectively translate the daily surgery schedule into a concrete plan of action for the department. This ability to translate surgical purpose and approach is what transforms the surgery schedule from a mere list of names into a daily roadmap for the sterile processing department. The schedule is typically generated the day before surgery, but as a technician, you must treat it as a living document. It is subject to constant change due to emergency add-on cases that can disrupt even the most organized plan. By reviewing this schedule, you can anticipate the department's workload and prioritize instrument processing based on the actual clinical need. Let's look at how you use your knowledge of terminology to decode a specific entry. Imagine the schedule reads, 7:30 a.m. Room 4, Dr. Smith, laparoscopic cholecystectomy. To the untrained eye, these are just words, but to a professional technician, this is a clear set of instructions. First, laparoscopic tells you the approach is minimally invasive, meaning you must ensure the laparoscopy tower, camera, light cable, and rigid scopes are ready. Next, the root chole identifies the gallbladder as the target organ. Finally, the suffix ectomy confirms the gallbladder is being removed. Your immediate action is to prioritize the lap chole instrument tray and verify that a backup camera is sterilized and available, preventing a delay before the patient even enters the room. Understanding the procedure also allows you to identify turnover instruments, which are high-demand items that the facility may have in limited supply. Consider a scenario where the schedule shows 3 total knee arthroplasties, or TKAs, scheduled back-to-back, but the hospital only owns 2 total knee instrument sets. Because you understand the term arthroplasty refers to a major reconstruction, you know these sets are complex and require a specific amount of time to clean and sterilize. You realize immediately that the first set used in the morning must be fast-tracked, meaning it is moved to the front of the decontamination and sterilization queue, to be ready for that third surgery. Without this terminology knowledge, the third surgery would be delayed, directly impacting patient care and hospital efficiency. In essence, medical terminology serves as the bridge between the clinical team in the operating room and the technical team in sterile processing. By mastering this language, you ensure you are not just washing dishes but are an active, vital participant in surgical planning. You are the professional who prevents dangerous situations, such as a surgeon asking for a saw during a procedure where it wasn't prepared. This is because you knew a BKA, or below-knee amputation, requires bone-cutting tools while a herniorrhaphy does not. This level of expertise is a cornerstone of professional growth and is a key component of attaining certifications like the CRCST. This certification recognizes the 400 hours of hands-on training and ongoing education required to master these critical skills. Building upon this professional foundation, we must consolidate our understanding by reviewing the key definitions that form the core of Chapter 2. These terms are the building blocks of your daily communication and professional identity. First, let's define an abbreviation. An abbreviation is a shortened form of a word or phrase used specifically to save time in medical documentation and communication. While useful for efficiency, you must ensure that only hospital-approved abbreviations are used to maintain safety and clarity. Next is the combining vowel. This is a vowel, most often the letter O, used to connect a root word to a suffix or to another root word. Its primary purpose is to make the pronunciation of complex medical terms easier and more fluid. We then have the prefix, which is a word element placed specifically before the root to modify or enhance its meaning. As we have discussed, prefixes such as pre or post provide essential context regarding timing or location. The root word follows as the main part of a medical term. It provides the central meaning and typically refers to a specific body part or organ, such as cardi for heart or gastro for stomach. Every medical term must contain at least one of these foundations. To complete the word, we use a suffix. This is the word element placed after the root to describe the specific action being performed or the condition that exists, such as itis for inflammation or ectomy for removal. Finally, all of these components fall under the umbrella of terminology, the specialized collection of words or expressions used specifically within the healthcare profession. By mastering these definitions and the structural logic behind them, you transition from a technician who simply follows instructions to a knowledgeable professional who anticipates the needs of the surgical team. This concludes our deep dive into the language of healthcare for sterile processing. You now have the linguistic tools necessary to ensure that every instrument tray you prepare and every schedule you interpret contributes to the ultimate goal of the sterile processing department, providing safe, timely, and high-quality care for every patient who enters the operating room.